ventral hernia is a hernia that occurs anywhere on the abdomen. Really, they could occur in any space, but most commonly they occur in the midline. The reason why is because in the center of the abdomen you have the linea alba, and it's a line that doesn't have very much muscular tissue. So that area can tear, and that could result in a physical hernia. The most common areas we will see ventral hernias are either above or below the belly button. Usually the way it presents is a physical bulge, but some people, either they have larger body mass or they have a little more skin or fat over their muscles, they may be less apparent and they may present more as pain in the abdomen area. Now, when we look for ventral hernias, usually you could feel them on examination. Either you feel a hole, which is a defect where the tear is in the abdominal wall, or you actually feel a physical protrusion when the patient coughs. Now, sometimes if the hernias are stuck or partially out, which is called incarceration, then the hernias are actually present with the bulge without any need to cough or push. If you can't feel a ventral hernia on examination, that's usually when we use additional imaging to find them. This could be an ultrasound, a CAT scan, or an MRI. Now, in terms of when you go and have surgery on a ventral hernia, it's just based off of symptoms and, of course, the appearance of the ventral hernia itself. Approach that we usually go for in terms of repairing the surgery is it could be done either as a direct incision or laparoscopically. Both cases, the goal is to reduce the hernia, close the abdominal muscle, and reinforce and repair behind it. If the ventral hernias are very small, then sometimes it could be repaired with just a few stitches.